Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below. Hello everyone, welcome. This is Dr. Jacobs. In this video, I'm gonna go over how to relieve or fix jaw pain, TMJ or TMD, temporomandibular joint dysfunction. It's very important to understand this three treatment has to be done simultaneously for the best result. You cannot pick and choose. I'm gonna work on one part of the treatment and assuming the symptoms will be resolved. Before I go over the three most effective treatment for jaw pain, we need to understand normal healing cycle so it will make sense how to treat the root cause of jaw pain, TMD or TMJ effectively instead of focusing on treating the symptoms that does not provide long-term result. So I'm gonna use external paper cut for visualization, but the same process happened when you have jaw pain. It happened internally, but we cannot see it. So I want you to visualize what's going on internally in the joint and in the muscle. So the first stage of healing is inflammation. As you see in the first image here, you can see swelling, redness, the blood start to rush to that area, and you start to experience pain and lose of function. Second stage of healing is called the proliferation stage. That's when the body starts to build the scar tissue and fascial restrictions, muscle spasm, and trigger points. In perfect scenario, actually during the maturation stage, the body gets rid of everything from the inflammation and proliferation stage. So I'm going to give you an example why fibrotic tissue or scar tissue could be an issue. If our body actually does not build a scar tissue or fibrotic tissue, it's going to be open wound susceptible for infection. So actually, fibrotic tissue is very essential for our survival. Too much is actually causing issue. Because our muscle should act like a rubber band. When it contracts and relaxes, stretch like this. When you have fibrotic tissue or scar tissue in muscle, it's like you have a knot and your muscle will not stretch much. So it's limited range of motion and you will experience symptoms of the TMJ or TMD by not able to open your jaw fully, or you experience clicking, grinding in the joint and having discomfort around this area. So perfect scenario, actually your body should release all of these inflammation and proliferation elements and clears up. But when you have chronic TMJ or TMD, your body probably going back and forth between the inflammation and the proliferation stage, that vicious cycle. So in order to treat it effectively, we have to address this healing issues. Before I go over the most effective approaches, we need to relate the ineffective treatment that's currently used so you don't have to waste your money and time on it. And I will leave a link underneath this video for the research that indicated those treatments either provide short-term pain reduction or no pain reduction. When we understand the normal healing cycle, it makes a lot of sense. None of these treatment is effective to actually treat the root cause of jaw pain. For example, ice, it's used for temporary decrease in inflammation, but it will not release the fibrotic tissue, fascial restriction, or it will not be an effective treatment for inflammation. The same thing with electric stimulation, foam roller, massage. Massage could actually cause more inflammation, but it will not release the fibrotic tissue, fascial restriction. It actually could cause more inflammation. Dry needle acupuncture, it will not break the adhesion in fibrotic tissue or the fascial restrictions, so it's not going to be very effective. Stretches actually is going to make it worse because based on a study, stretch could cause more fibrotic tissue. If you overstretch, you're going to cause tear in the muscle and will cause more inflammation. Unfortunately, there's a lot of videos on YouTube that promote saying that stretches and strength exercise will resolve the problem. It actually will make it worse. So I personally do not recommend it for my patient because it make it worse. And when we look at the healing cycle, if you have a knot in the muscle and you keep stretching, you're gonna snap it more, cause more micro tear, cause more inflammation, and the more strength exercise you're gonna do is gonna cause more inflammation in the joint. If we want to introduce a strength exercise, we need to introduce it in the right time, not during the inflammation stage, which gonna make it worse. So what is the most effective approach to treat the jaw pain, TMJ or TMD? We have to break that vicious cycle. The first thing I usually do with my patient is decrease the inflammation. So if you have acute jaw pain issue, rest for 2-3 weeks. That should resolve it. But if you notice after 2 to 3 weeks the symptoms not going down, and if you notice the symptoms going up or the same, that's an indicative that you have chronic condition of jaw pain, that your body going back and forth between the inflammation and the proliferation stage. So what I personally do with my patient is I use a MagnaHeal 2. This is very strong magnetic. It goes deep in the body, penetrate the body by like 3 to 4 inches. So this is what I use to decrease localized jaw inflammation. At the same time, I have to use an anti-inflammatory diet because a lot of food that cause internal inflammation that slow down the healing cycle. So I put my patient on anti-inflammatory diet, and it's very common with those patient that has chronic jaw pain that they have severe deficiency in vitamins, mineral that cause the body to be slow down the healing cycle. For example, you need D, you need magnesium, you need B, you need C for your body to go smoothly from inflammation stage to proliferation stage to maturation stage. So what I usually do is a very intense nutrition evaluation, look at the vitamins mineral panel to make sure there's no internal inflammation as related to deficiency in the body. While I'm working on the inflammation, as I mentioned to you, I have to work on the other two elements to break down that vicious cycle. So the second element is fibrotic tissue. So when you look at this image, the first image for the muscle, this is a normal muscle, there's no issue here. When you have micro tear in the muscle or tear in the muscle, that's what it looks like. When your body builds the fibrotic tissue, it builds it randomly like this. The problem that actually we have with the jaw pain, those area you don't have a lot of room to build excessive fibrotic tissue here. And with patient with jaw pain from clenching, grinding, you will have muscle strain in the temporalis muscle here and the masseter muscle. And when you palpate in this area here, you will notice there is a nod. That's very common with the jaw pain. That's fibrotic tissue that limited your masseter muscle from fully contract, so you will not be able to fully open your jaw. So you will have clicking or even locked jaw, that this muscle is kind of spastic and limited the range of motion. So we have to work on releasing the fibrotic tissue while we're working on the inflammation. So what I personally do with my patient for jaw pain, I use the A3 to break the fibrotic tissue from the masseter temporalis muscle, and I work around those areas here to release any fibrotic tissue that limited the range of motion. I also use the A5 to go deeper to break deep adhesion fibrotic tissue in the muscle around the jaw area and the neck area. While I'm working on the fibrotic tissue, I have to release the fascia restriction. So that's the third part of the treatment, fascia restriction. So next time when you go by a meat, look at the white filament. This white filament is the fascia layers. And you can see it on this image here. The white filament is the fascia layer. And here in the face area, you can see this is fascia. All that white tissue is actually the fascia layers. So to make things complicated, but don't worry, the treatment very simple. Our fascia system divided to two major categories, superficial and deep fascia. And the deep fascia layer divided to 4 subcategories: the apparatic fascia, epimysin, premiysin, and endomysin. And each of these layers have 2 to 3 layers on the top of each other. So when you have fascia restrictions, for example, the superficial fascia, it's like layer wrapping the entire body. When you have fascia restriction, it's like you're wearing a t-shirt 2 to 3 size too small. It compresses on everything, and it actually could cause headache actually for the jaw pain. So the fascia layer, it feels like something compressing or putting pressure on the joint, and actually will limit the range of motion of the joint. And you can see it here. The epimycin is a layer wrapping each individual muscle fiber. And then we have the premiycin wrapping a group of muscle bundle here. And each individual muscle fiber bundle, muscle fiber is actually wrapped with the endomycin. So it's a very complex system, but it's very important to address the whole system. So while I'm working on releasing the fibrotic tissue, I actually release the fascia restriction. So what I personally use is the A1 to release superficial and aporetic fascia layer. It's very important to release all the layers of the fascia. And at the same time, I use A5 to release the epimycin, premiycin, and endomycin. And I will leave a link underneath this video for those tools on how to use it at home. If you have any question or comment, leave it in the comment section and I will answer it in the future video. See you soon! Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below or go to asterinstitute.com.